Welcome to the live checkup. This is where we sit down with Dr. Asante Le Blanc and ask all the possible questions we can when it comes to our health and care. Let me just tell you this first off. Dr. Asante Le Blanc is the medical director and owner of Victoria Clinic, your home for holistic health care in Trinidad and Tobago. Victoria Clinic is located at 54 Galley Street in Woodbrook. Dr. LeBlanc is a medical doctor and certified medical herbalist. She is an integrative health care practitioner, bringing together the eastern and western branches of medicine so as to better guide patients on their path to optimum health. She's also a certified clinical densitometrist, specialist in diagnosis and treatment of osteoporosis. At Victoria Clinic, services offered include medical consultations, traditional Chinese medicine consultations, acupuncture, medical herbalism, blood tests, electrocardiograms, lung function testing, and Dexter bone density testing. You can contact Victoria Clinic at 622-2221 or 622-0683. Follow them on Facebook, Victoria Clinic, or Instagram, Victoria Clinic_Trinidad. Website, www.victoria-clinic.net. This is the live checkup. I'm JD. Now, let's jump into today's conversation. Hey guys, welcome back to another episode of the live checkup. I am JD, and this lady right here, well, that's Dr. Asante Le Blanc. And you would have heard a little bit about her and Victoria Clinic, their location, and what certainly you can get at that location. But again, we're going to share that later on inside of our time. But I do want to say thank you as always for connecting with us. Click like and subscribe. That's all you need to do. Share this video as well. And I love doing this on the YouTube platform. Therefore, it's cemented. It's there for a long time. So in case you missed this, or in case someone you love misses this, you can certainly share. So how are you, Dr. Asante Le Blanc? Long time no see here.
Hi, everybody. Hi, JD. I'm good. I am working hard and trying to stay sane.
Yes, I just had to shut down everything else because we're going to hear all the WhatsApp messages coming. But it's good to have you here. I know it's a crazy time. We're still living inside of the pandemic, so that's always going to be our most common challenge, which is affecting everything else in our life, whether it be personal, school, professional, it's being affected. However, we are inside of this brand new month, and, you know, it is a very important month. Not just that the spotlight should be shone on this at this time, but it is the month in which it is recognized breast cancer awareness. And I thought, well, I had to have the chairman of the Trinidad and Tobago Cancer Society, Dr. Asante Le Blanc, here to discuss this with us and answer all those questions. So you can also put your questions in the chat that we have below, and Dr. Asante Le Blanc will answer it. Breast cancer is cancer that forms in the cells of the breast, right? And I was reading something earlier on that says in the US, skin cancer is the most common cancer, but breast cancer is right behind it. And the numbers may be pretty high when it comes to breast cancer across the globe. So let's deal with the discussion right here in Trinidad and Tobago, connecting with maybe what's happening internationally. Dr. Le Blanc will know about that, but let's go straight into it. Dr. Asante Le Blanc, breast cancer. You can go a little bit deep inside of it. What is breast cancer, if you can, to start things off?
Well, JD, breast cancer, as you well put it, is a cancer of the breast tissue. What is cancer? Cancer is a group of diseases characterized by cells that are multiplying and functioning in some cases abnormally. And this is where programmed cell death or apoptosis is lost for some reason or the other. There are many causes of cancer, and in this case, it's your breast tissue that is growing it's basically deranged, it's growing out of order, but it has functionality with it as well. And it may be receptive or not receptive to certain hormones in the body. And you get the characteristic breast lump or breast discharge, depending on the type of cancer that you have. And the disease then can spread locally and then distant via your lymphatic system and your blood, your circulation, your cardiovascular system. And then you have distant spread or distant metastasis, and therefore, ultimately, if not treated, can lead to death.
So basically, this is the area when you call locally, and then it spreads to other parts of the body?
Well, so let's say cancer starts in your left breast, which you'll be
Right.
seeing on your right. Then it can hop over, so it can go through the lymphatics. So it goes locally to the lymph,
Right.
and there's breast tissue in the armpit area or the axillary region. So it goes there, or via your lymphatics, it can jump over to the next breast, right?
So I,
And
s-
then it will spread distant.
I see why, as you described here, because yesterday, guys, if you didn't know, you would have seen the photos that I did go to the Trinidad and Tobago Cancer Society this
Where
week
you should go all the time.
all the time. And this, maybe this is about my fifth, sixth time checking you guys out. So anyway, and I took a friend along this time, Dr. LeBlanc. First time
So
for her.
you got the Scotia promotion. Thanks to
Promotion,
Scotia
yes.
Bank, we have a promotion, buy one get one free kind of thing.
Yes. So like a BOGO seal. So I took her along, but during the process of my mammogram, because I did all three, mammogram, ultrasound, and pap smear as well, just being there one
The
time,
combo package,
the combo
awesome.
package. So one of the things I noticed, I'm not sure of the correct name of the person who does the mammogram, but
The mammographer.
mammographer. She was really nice, by the way, very friendly. And she was always trying to get my lymph nodes into it. She says, because I was like, always trying to, but I understand now that you say it could spread through something that's happening, lymph nodes are
Well,
are
she was trying
involved.
to get as much of your breast tissue
Yeah,
captured because those who are well endowed, we have to get the capturing of the breast tissue.
well endowed.
And so the more we see, the better it is because we need to see the axillary region or the armpit region to make sure the breast tissue under there is okay as well.
So we'll talk more about the exam later on and who should do it and when we should do it. But let's start off with the signs and symptoms of breast cancer and what they may include, Dr. LeBlanc.
Okay. So it's very important to understand that you must always look at your breasts in women every month after your period. It's very important that you examine your breasts. So the first thing you look for is changes in the skin of the breast or the nipples. The nipple that was once normal and outward, is it going in? Is it inverting? Look at the skin, make sure it's not starting to have a rash, a strange rash, redness, or turning to the texture of what is similar or reminiscent of orange skin.
Right.
When you're examining your breast, you examine your breast, and we'll go through the examination later. You're basically looking for lumps because a lump is what is your most common sign of breast cancer.
Right.
A discharge from the nipple. Most times it's a bloody discharge from the nipple, and it's unilateral and not bilateral. So it's from one breast. Lumps under your arms associated with the lump in the breast, pain in the breast, sometimes just a strange pain in the chest area that's not going away. Um, and sometimes that's all it takes. Those are the main signs and symptoms of breast cancer. But then you have the general symptoms, which include fatigue, weight loss you can't explain, bone pain you can't explain, um, shortness of breath at times. Those
Mhm.
are all possible signs and symptoms, again, of breast cancer. And that's dependent on the staging of the cancer. Has it spread to other organs and so forth?
And some of the extra symptoms you mentioned look like other things as well. So it's always important to
Correct.
have that conversation with your general practitioner. When is the best time, though? Oh, sorry. Those symptoms that you mentioned, would that be the best time when I should go in and speak to my doctor about it?
Well, as a discussion, your doctor should have spoken to you about your monthly self breast examinations, which should happen about 5 days after your period ends. That's when, because remember, your breast tissue will respond to hormonal changes with your menstrual cycle.
Right.
So you will have more tenderness coming onto the period. You may feel more lumpy or denseness in the breast tissue, especially if you have dense breast tissue, which is common in younger women and women of African heritage. So you want to know how your breasts feel. You want to know your breasts. So you do your self breast examinations on a monthly basis, if possible, if you can remember, because we all know what happens. So at
Mhm.
least every other month, I would recommend. Your doctor should do an annual clinical breast exam as well, and see how your breasts are looking. And once you hit the age of 40, we do the mammogram along with the clinical breast exam as your screening test for breast cancer, right?
Right.
But you have to know your breast. You have to understand your breast, and you don't wait to feel symptoms. So your question is, should I only go in when I feel symptoms?
Yeah.
No. You, when you go in annually for your annual checkups, it should be discussed. Your breast health is important. Knowing your family history, understanding the women in your family, did they have breast lumps? Are you prone to fibrocystic breast disease? Do you have adenomas of the breast? Because those are benign, non-cancerous lesions of the breast. Are you on any medication that is hormone related? Are you exposed to anything? What is your job? Those are very important questions, and things you should know about. And knowing your family history, understanding your diet, your activity level, what you're eating, how you're eating, your stress mechanisms, stress coping mechanisms, what stressors you have in your life right now, I should say. How are you sleeping? Because it's very holistic and your body is holistic. So though you should always go to your doctor, but yes, if you feel a pain that is not, it may be cyclical, so it comes with the period, then you should still let your doctor know
Right.
about it so they can decide, do you need to be worked up or not? If you feel a strangeness, any lump that you feel, it's never a mistake to go in and get it checked. And I can tell you, JD,
Mhm.
I have a very, um, no, it's not a funny story, but I have a friend who's a breast cancer survivor.
Right.
And she'd done her chemo, she'd done everything. And she came to me one day and she says, Asante, I think I'm feeling a lump in my other breast.
Oh,
And I said, oh my gosh, don't worry about it, man. You got this. You've survived this. You've been through hell and back. We good. And she's like, no, I'm not too sure about this. So I said, okay, come in, because generally if she says that, something is wrong. So I said, come in, and we did the examination and I felt it. I said, yeah, something's not right here. Because we know how the lumps will feel. There's certain characteristics that we look for as physicians. So I said to her, I said, okay, let's not panic. Let's do an ultrasound. Let's see what's happening. And she had cancer. Her cancer had returned to the other breast. um and I say this because women have intuition, and we have to listen to our bodies, know our bodies, and don't be afraid to go into your physician. Don't be afraid of the diagnosis, because you need to be empowered enough to know you can face it, and you're not alone. The Trinidad and Tobago Cancer Society is here to support you for sure, and your friends are there, your family are there, but you have the support. So it's important to make that mountain out of a molehill, so to speak, and know your body and go in and speak to your physician.
One of the things I heard you say just a few minutes ago about knowing your family history, can you touch on that a little bit? Because when I was filling out the form at the Cancer Society, I noticed that that's one of the questions they asked, if anybody in your family has had breast cancer or any cancers at all. Can you just also speak to that on the importance of knowing that history? And I'm sure
So
it's
it's
not be all and end all, but
So it's important to know if the women in your family have had breast cancer, and also the men in your family have had breast cancer, because men have breasts as well. People don't
right,
understand that, but it's not as common for men to have breast cancer in Trinidad and Tobago. So it's important to know how the women's breast health have been in your family from both maternal and paternal sides. Understand your grandmother's history and even your great grandparents. But from grandmother go down is fine. Your sisters, your niece, those kinds of heritages. You have to understand your lineage and understand what's happening in your family. The reason being, there are some links, some genetic links to breast cancer. So that means that there is a risk factor of family history being a big risk factor for certain cancers. So it's important to know. And then there's now genetic testing being done. We don't do a lot of it in Trinidad and Tobago, but this is when we see very aggressive cancers and certain type of cancers. Then the oncologist may decide to do a genetic screen of that cancer in that patient to determine what they need to look for in the other relatives to know if it's a common genetic cancer, or if it was a one-off in that patient. So it's important to understand the history and not just say, oh, and not only that, JD, if you had a mother or an aunt on your mom's side that died of breast cancer at the age of 35, then it's important to know that. because the genetic testing may not have been done in that time, but
Right.
it may prompt an earlier start to the screening for that, for you as a patient. So it's important to understand your family history for sure.
Over the past few days, I don't know if you saw it. If you remember this particular personality, Ananda Lewis. Do you know that name from the US?
No, I saw you post it on Facebook.
No, I was looking at the interview because I think I sent you the interview via Instagram. So check it out where she was speaking, her disclosure. And she was a VJ, very well known VJ in the US with MTV and BET. But anyway, being in the field, I would follow her and just pay attention to her. But she disclosed most recently that she is actually stage 3 breast cancer. She has stage 3 breast cancer. And she's talking about, she's been dealing with this for the past 2 years. And the main reason for her conversation or coming forward via the platform was to inform us women of the importance of doing a mammogram. We risk for breast cancer, obesity, radiation, family history, things like that. What are some of the other risk factors that are out there when it comes to breast cancer?
Before I mention the risk factors, I think it's important to debunk the myth that mammograms cause cancer.
Right.
Um, it's important for you to understand that this is the screening. This is the gold standard screening for us at this point in our population. Like everything in medicine, things may change, systems may get better, but for now, this is the gold standard. Radiation as a risk factor speaks towards those who work, for example, in the X-ray department of a hospital. So that's why we now have little meters to measure the dose of radiation, because long ago they never had these OSHA guidelines. So the radiation they're speaking of is just direct onslaught of radiation from things such as X-rays, from different gamma rays and different machines that you can get radiation. So the mammogram is not the radiation they're speaking about.
And that's not
And
what she was
in
speaking about. I just
fact,
want to say that. I just want to say that as well. It's not that
it's
she
not
was
right.
saying.
I'm saying the perception, right? But the perception is that all the machines have radiation, and they
Right.
don't.
Mm-hmm.
So that's important to understand. Amongst the risk factors of breast cancer, we can start with the general risk factors, which include obesity and a sedentary lifestyle, meaning not exercising properly and
Right.
effectively,
Right.
an imbalanced and unhealthy diet. Knowing, and we speak about this day in, day out, week in, week out, about what to eat and how to eat. So I'm not going
Right.
to
Yeah.
delve into this.
Right.
Eating unhealthy is a risk factor. Smoking is a risk factor. Excessive alcohol intake is a risk factor.
Wow.
Poor stress coping is a risk factor. Poor sleep habits, it's a risk factor. So this leads us to understand once again that cancer is a lifestyle disease. And this means that if you don't modify your lifestyle from now, then you are putting yourself at risk for the lifestyle diseases or the non-communicable chronic diseases or the disease. So there's no ifs, ands, and buts about it. Then we have family history as a risk factor, excessive estrogen stimulation as a risk factor. Those are risk factors for breast cancer. There
Right.
is talk of some viruses. We do not have the viruses pinpointed, but there's also talk of exposure to external carcinogens or cancer-causing products, and that includes things such as asbestos and other products that have now been removed from most buildings, if not all, according to OSHA guidelines. But these are the risk factors for cancer, for breast cancer.
And as you speak about risk factors can apply to anyone, no matter size, age, race. And I say that because most recently I was chatting with a friend, and I was saying to her, I was trying to invite her to do the mammogram with me, and I said, "Do you want to go? Have you done it?" She's my age. "Have you ever done it?" "No." "Do you want to go do it?" She's like, "No, my boobie's too small for that." And I thought, it has nothing to do with how small you are or how large you are, endowed you are. It is just about the risk can apply to any one of us, and we need to pay attention and check ourselves. She does do the home self-check as well. I'm not saying no, but at the age of 44, she's never done a mammogram. So can you speak to also those who believe that size matters or doesn't matter, as well as should we make it mandatory once you've crossed 40 to do this?
Once you cross 40, you need to do that. You need to have a mammogram and or a breast ultrasound.
Right.
There are women that are very, 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 very poorly endowed. And therefore, there's no tissue to put onto the mammogram plate.
Right.
Those women, we do the clinical breast exam and the breast ultrasound. But we look at their family history, we look at different other factors. Those women who are very well endowed, we will tend to do both the mammogram and the breast ultrasound because they may have more dense breast tissue, right? You know, JD, I know that women think that, oh gosh, is another test. But as you did, where you did your mammogram, your ultrasound, and your pap smear, you screened for 2 cancers on the same day. And it's important. I can't stress how, and I know the viewers are going to say, how come she's not laughing so much today? And it's because this topic is one where we're so afraid of cancer. We think cancer equals death, but yet we're afraid to do what it takes to be proactive. More than buying a shoe, it helps when you do that, because guess what? We at the Trinidad and Tobago Cancer Society are able to further subsidize our services and allow for more women to get screened at a lower cost. So we're allowing more access to these services.
Thank you for that.
But encourage your friends, your sisters, your mothers, your aunts to get screened.
Yeah.
It's amazing how many lives we can save with a mammogram versus how many lives we will lose without the mammogram. So it's important to have the discussion. And for your friend who is not well endowed, you do your clinical breast exams, you do your monthly self-checks, but you still need to have at least an ultrasound, an image, for us to see if there's anything hiding. Is there anything wrong? Speak to a professional to understand. And that's what women need to do. Understand that it's not only when you get sick that you go to a doctor. A doctor needs to see you in your healthy state and your normal state, so it's proper detect when things are changing. So if I have a woman who comes to me every year, for example, JD, I'm going to pinpoint her, then I know when JD is not exaggerating. I know when there is a subtle change, most times. I know when there's a subtle change in JD's life in terms of her health. But the reality is that there are different things that you look at. You understand? So it may not even be that you felt a lump. It may be just JD saying, oh, I'm looking at the breast tissue and saying something doesn't look as like it did last year.
Right.
Have you done anything differently? And those are the things that we have to gauge. And that is why it's so important to have the discussions, be frank and not be afraid of any kind of diagnosis.
I think that's the important factor there. Many people are afraid of it. I mean, going in, when you walk in to do it, you're nervous because you never know, but it is something that we have to do. And, you know, again, this month is packed with so much information in terms of breast cancer awareness. And I know you and the entire crew at the Trinidad and Tobago Cancer Society continuously put out the information around that, COVID or not. COVID is changing things around, because I know usually you will have some sort of events and stuff like that. That has been somehow twisted in some way, maybe virtual. That's what you will maybe do, but we'll find out more later on. So we spoke about the different risk factors, what they are. Can you just now speak to us about doing that self-check on our own? Can you show us what we need to do for those of us that are not aware? Of course, I know you can't show us, but, you know.
Well, you won't see my breast today, and that's on that I can promise you. But, okay, so let's see if I can put that there for you to get. And so okay, so let's pretend I had no clothes on.
Right.
So you're looking at the mirror and you look at the size of your breasts, you look at how the breasts are looking and compare that. Remember that no breast is going to be the same unless you pay for them to be the same.
Right.
Right? There's always going to be a little discrepancy. So you're looking at the breast skin, the tissue, how the nipples are looking. Then either lying down or standing up, you put one hand behind the head. And then with the other hand, so the hand of the breast you're going to examine is behind the head. The other hand, you're using the tips of your finger, and you're slowly examining your breast tissue in a circular motion, and you're going from outwards to in. And then you squeeze the nipple, And then you feel under the axilla or armpit region, and you generally will put the hand down to go deep into that region, and you feel that. And then you do the other side, and that's it.
And this is what we should do every month. How late after the period?
5 days after your period has ended.
5 days after the period. So, and this is something we check whether lying down or standing up. We should do it on our own. Ladies, I hope you
And
do.
you do that and understand it and see. So people like JD and myself who are well endowed,
I was going to ask
it's
you about
important to know and to feel your breast. And don't worry when you feel the lumps, because you'll know. And you can do a test. Feel your breast during your period, before your period, during your period, and after your period. And that way you'll feel the difference in the lumpiness of the breast, the tenderness of the breast. So I know, for example, premenstrual, how my breast feels. So when I feel anything and you feel the tenderness and the fullness, women, you know what I'm talking about. Feel that and see how lumpy it's feeling. Sometimes even your partner will be the one to find the lump,
Yeah.
depending on how good or detailed they are.
But one thing you said about when we're doing our own checks, like I can say this here, and yesterday, I keep saying yesterday, but most recently when I did the check at the Cancer Society, the young lady was just explaining to me again, the difference between density and what's basically what's regular. Because sometimes I feel it and I'm like, what's this? And I'm sure I've come to you before and said, Asante, check
Many
me.
times. Many times. Many times,
That's
but
how
I
I
didn't want
walk
to
in,
blow
guys.
it up. I wanted to be normal, I wanted to not worry about it. But yes,
But
many times, many times.
explain that. I mean, I'm not gonna come again soon. Maybe next month or something. But anyway, what can you explain that density thing? What is it I'm feeling? Because it does feel lumpy, but it's not that. It's just dense, isn't it?
But it's just your breast tissue. So it's just that your first of all is that it's the structure of the architecture of your breast based on
Right.
your ancestry. That's all it is. It's a matter of the fat and the breast cells. So when we say dense, it's just that it feels more lumpy. It's not as smooth, and that's because of the makeup of the architecture of the cells. And
Right.
it's just important to know, for example, I have lumpy breasts. And so I've had many lumps, but never big ones. So let's say you find a lump and you go to the doctor says, okay, I send you for an ultrasound because you're young, whatever. You're not of the age for a mammogram. We do the ultrasound, it comes up as a cyst. So there's something called fibrocystic breast disease. So when we see the cyst, we monitor the cyst. What are we looking for in the cyst? We're looking for a simple cyst. We're looking for a cyst that's not growing excessively. And most of them may pop. And that's it. We have seen cysts that are complex, and that's a whole different discussion. That's not really necessary for this forum. But if you have a complex cyst, then we may take out liquid out of the cyst to test and make sure the cells are normal, right? So these are things, but you can't be afraid of it. So you feel the lump or you feel something, go to the doctor. Let us work you up. Let us see what's happening, and it's so important, JD. But a dense breast doesn't mean it's not equivalent to cancer. A dense breast means the architecture of your breast is one that is lumpy. And as you get older, it may change. It will change. If you have children, it will change. Hormonal stimulation changes it. So different things will affect the breast architecture.
All right. So, Dr. Asante Le Blanc, let's talk about. So, we spoke about our self check. Can you just tell us what happens inside of when doing a mammogram? I certainly know what it is like, but tell persons in your profession, as you know, you can simply explain it better than I can.
I don't know if it's that I can explain it better. So Trinidad and Tobago Cancer Society, what we do is you call us, you make the appointment, 800 TTCS, or there's a number on Facebook that you can find. I can't remember the number right now, but you go on our Facebook site, Trinidad and Tobago Cancer Society, and you'll find our digits, right? You call, you were sent to have a mammogram done or your pap smear by your physician, you were referred, or you can self-refer, which means you're going there on your own.
Right.
That's fine because we have doctors in-house in case we have to explain your results to you, should they be abnormal. You make your appointment, they will ask you certain questions, especially if you're young and of childbearing age. They will ask you about your period and so forth to ensure that they're booking the appointment at the right time. You go in, You do, well, it's COVID, so temperature check, wash your hands, temperature check,
Yes.
the usual, you'll be triaged, and you sit in your waiting room. Time for your mammogram. You do not wear any powder, cream, or deodorant on the day of your mammogram. Very important. You go in, you do your transaction. They take off your shirt, your all your jewelry, your bra. They give you a nice gown,
Yes.
and they proceed to do the mammogram. The mammographer will put you in different positions, and yes, it is uncomfortable. It's two plates coming down. They're not as uncomfortable as they used to be because we now have the mammogram machine, which is the latest technology in very easy compression and very little pain. It comes down, they're going to put your breast in between the plates. They have a certain position. They measure that, and then they'll turn you obliquely, and they will measure the breast from a different angle. That's the end of the mammogram. It
Okay.
does not kill you. It's not going to kill you. You're not going to die. If you've ever pushed out a child.
So, all right. So you just explained the process of the mammogram. Same thing I just recently went through. Yes, there's some sort of discomfort, but it's nothing to scream about. You know what I mean? It's just like, ooh, okay. And she did, as you said, put me different angles to, I guess, get the photos or the X-ray, wherever you needed to get it in that area. So, and what, maybe less than 10 minutes, in the process.
Depending on how well endowed and how cooperative you are, it could be 10 to 15 minutes.
If you ask my friend who went along with me, she said, "How you took so long inside there?" I'm like,
you're well endowed. It's a lot. It's a lot. It's a lot to deal with.
Right. So explain the difference, because I did both the mammogram as well as the ultrasound. Can you tell the reasons for having both done, and what is the difference, of course, with the other one in terms of what they're looking for that maybe they didn't pick up in a mammogram? How does it work?
No, well, sometimes the mammogram may pick up something such as a dense mass, or it may see something that's suspicious. So the ultrasound, using ultrasound waves, the ultrasonographer, or the radiologist, in the case of the Trinidad and Tobago Cancer Society, the radiologist goes through using the ultrasound probe to identify and to correlate the results. So that if we have two different views from the two machines, we're able to correlate and determine then if we saw anything suspicious, if we needed to do what we call a spot compression, meaning going directly to that spot, compressing a little more to see the details of what we think is suspicious. So the ultrasound is used in cases where we see dense tissue and we need to correlate along with the clinical breast exam and the history of the patient. We use the ultrasound.
And I would say, though, when they did my mammogram, it says, looks fine. But I just wanted to have, me, Jay, right?
And some women want to do both. So I have dense breast.
Yeah.
I have dense breast tissue, so I have to do both. And so some women just want to do anything that says, and it's good to, if that's what calms your mind, then all systems go. But I don't want that what calms your mind is saying, I don't need a mammogram or an ultrasound. I'm good.
No,
that's
at all.
Where we're crossroads. So that's important.
So I'm 44, so I think I've been doing mammograms even before I started, hit 40. So I seriously make sure and do that every year. I'm like, Asante, it's that time. So it's just important for me to do that. Both of them, actually. So tell us about what else the Trinidad and Tobago Cancer Society has in store for us this month. Also, I know you being that amazing doctor who also tells us about what we have in the garden or in our pantry that we can utilize in a healthy way as well when it comes to just treating our bodies better.
Well, JD, the Trinidad and Tobago Cancer Society is 50 this year. So we had all these beautiful plans, and like every other organization in the world, COVID has reset those plans. So the Trinidad and Tobago Cancer Society we collaborate with a lot of corporate TNT during October with breast cancer awareness. So Scotiabank Foundation, Massey Stores, Republic Bank, Payless, Unicoma. There's so many organizations that collaborate for October. I mean, so many people call to try and see how they can help during October.
Right.
So this, we ourselves at Trinidad Cancer Society, what we do is give more information, continue to educate and promote screening. But we also had the promotion thanks to Scotiabank Foundation. We are doing a 2-for-1, and then we will have some more for Republic Bank as well, thanks to them. Our main activity would be out of October, which is our Bubbles for Life virtual event, which is in November. So that's next month. So you can find information on that on our Facebook and our Instagram pages. And it's an exciting event. We're on the 21st of November between 2 and 6. Once you're registered, any activity, you pose and do a selfie or a video with that shirt on, with that doing that activity. And we have the hashtags stronger with together, Bubbles for Life 2020. We have a lot of hashtags that you put up with it. And therefore Power to Make a Difference, TTCS, all these hashtags. And it's just a celebration on that day with Bubbles for Life, because we want to empower survivorship as well. We want to really highlight the fact that you survive it, and highlight the fact that we can beat this terrible disease, which in itself is a pandemic, which is cancer. But for October, we are just collaborating with a lot of corporate TNT to promote screening, promote education, and truly just empowering women and men to take charge of their breast health and to just get screened.
You just said something, and that just reminds me, let's speak to the men, because we can't forget the men. They too may be looking on now and saying that has nothing to do with me. Can you speak to men about breast cancer and what they need to do?
Well, it's simple. Men have very little breast tissue, so they just need to palpate their breasts, feel their chest, and go to a doctor if you feel anything resembling a cyst or a lump, sorry. And that's it. Men don't do mammograms. They don't have any breast tissue to do mammograms. They don't have enough to do mammograms.
So they will do the self-check, and what in your years of doing this, have you, without calling names, have you noticed or have you witnessed males who have breast cancer?
No, I have 2 people I know of, but it wasn't me diagnosing it, but I haven't seen it a lot or prevalent in Trinidad and Tobago.
Okay, so there are persons that may have it, men.
Yes.
Mm-hmm. All right, so brothers, you don't have to go get that machine squeezing you down. You just need to do your own self-check. All right. So you told us about some of the things that are coming up with Trinidad and Tobago Cancer Society. Of course, you've got Bubbles. Is it Bubbles for Life? That's next.
Bubbles for Life next month.
Next month. So a lot of packed activities. Never mind the fact that COVID is in our midst. As you said, this too is a pandemic. Can you speak to, before we get ready to wrap it up, Dr. Asante Le Blanc, some of the things that we need to adapt or maybe include in our life, whether it's out of our pantry, out of our garden, that can help maybe in the process of becoming healthier? I know you're going to talk about balance with exercise, so you can jump on that first off. I know.
So JD, I mean, I think I wanted, and my husband said I got very animated when I started this topic. I want us to understand that we need to, I think I was doing an interview and he said I sound so like, oh my God, so like, but anyway, that's a whole different situation. But yes, living as healthy as possible within what we can. You know, and I spoke to, and I speak to always the balance in life in terms of exercise, eating healthy, stress coping, and sleeping well. For those women who have been diagnosed with breast cancer, when you ask them what they've done, you'll find that a lot of them have modified their diet. Some are vegetarian, some are vegan, some have gone green. The plant-based diet is a big rage right now. Now, this is all possible. It's all plausible because of the quality of food that we have now in the world. But I want you to pay attention and don't do anything rash. Understand your slow transitions if that is a lifestyle that is for your body, and do not do it just rash. You know, understand the quality of plants that you're eating, because you have to know that you're getting all your micronutrients along with those changes. So, I know people like to hear about the green juice every day and all these things every day. And, I say to people, it's fine to do your green juices in your smoothies, but you also have to listen to your body. So sometimes you have to see how energetically balanced those smoothies and those juices are, when to drink them, how to prepare them, how to prepare your fruits and your veggies for it. So I think it's important to also understand that it is an individual decision when you decide how you're going to have that green smoothie, green juice. But I do recommend using, as you know, ginger, turmeric, the greens that are that have antioxidants in them, because there's something called oxidative stress, which has been noted to affect the genetic machinery, which can possibly lead to cancer. So this is where big stresses can impact on your body and cause, different diseases. JD, I like, people talk about soursop and the
Yeah.
breast cancer saving effects of soursop. Soursop is being investigated, and it's a soursop leaf that's been investigated, as well as the fruit, in terms of being a possible, I don't want to use the word cure, but a possible protective effect when it comes to breast cancer. I don't like soursop. Um, I don't know if I get diagnosed with breast cancer if I will then start to have soursop. But at this point, I know it's being investigated. And if you like soursop, it's definitely something that's known as a healthy superfood as well. Using
Teas, I guess, too. Sorry.
Pardon me? Yeah, the
No,
leaves
Granny
make good
talks about
tea, and they
tea.
help you. Right, the tea
Yeah.
is good for sleep as well. Um, a lot of people will talk about moringa, noni, aloes, black seed oil. All these things are out there, but nothing has been very comprehensive as saying this is going to protect you against breast cancer. So it all boils down to knowing your body, how you assimilate the foods, knowing the quality of your foods, be it if you're animal based or plant based or omni based or whatever base you choose, but understanding the quality of your food,
Yeah.
what you're putting into your body, how you're preparing it, not a lot of excess barbecuing, over burning, not
Yeah.
a lot of fried foods, not using old oil. You can't have that fast food, and I won't call the names constantly and daily. So, and as I said in my interview during last week, COVID has allowed us to eat more local and eat more natural, which is something we've been proponing and proposing over the past year and a bit on this forum. And it's about going into your garden, using your garden, or knowing your gardener, or knowing your farmer, to get what is local and what is natural and does not have a lot of pesticides, does not have any GMO, it's not genetically modified. Understanding that, JD, but most importantly, I think not stressing about the food, because that becomes a problem. So understanding that within my budget, this is what I can do. And I will have my fresh fish, I will have my fresh eggs, understanding that and eating according to what your body wants, needs, and how it feels, and how it responds to the food, the seasons, and everything that's going on around us now.
Now, Dr. LeBlanc, if I can give you a heads up, I think our next conversation should be just having that conversation with persons who are living in remission of breast cancer. What are some of the things they have to endure? So let's talk to the breast cancer survivor on another episode. I think that's really important, because there's some amazing women who have defeated this and living today just many years. My girl Marcy Miranda being one of those. And I'm sure you can talk to those who may be looking on in terms of breast cancer survivors, or someone going through that breast cancer situation right now, speaking about what they need to do after or during the process, a little more deeper in terms of that conversation. So can we do that in another episode? Would you be able to?
We sure can, but I mean, I can tell you that as a preempt and a preamble, that everybody needs to do the same thing,
Right.
which is eat as healthy as possible.
That's possible.
Now, when you're going through chemo, radiation, we can
That's
talk
what
to
I mean.
that.
Yeah.
And yes, that can be done. But I think it's important to know your diet, understand your diet, understand what you're putting into your bodies. And don't just jump on these bandwagons that you're going to starve cancer by not eating any meat, any sugar, any this. And
Right.
next thing you know, you're so weak, your body can't take the treatment. So be balanced about your thinking, about your way of life. Don't be afraid. The Trinidad and Tobago Cancer Society has tremendous resources when it comes to that. We have a survivor group that will help you through. We have a counselor. We can help you through it. And we have physicians like myself who will speak with you if you need it. So don't be afraid of that. And Trinidad and Tobago's public health system has amazing oncologists and doctors who can help you along that way. And so you're not alone. And it needs to be a multidisciplinary approach to your treatment and to your if you're ever diagnosed with breast cancer. But I think it's very important to remember to get screened, get educated, be proactive, because early detection is definitely our best weapon right now against cancer.
And I'm so glad we discussed that inside of this first episode about screening and getting early detection. That's vital. Everyone has heard us talk about what you can certainly step into the Trinidad and Tobago Cancer Society. So go there, check them out. If you do need to call Victoria Clinic for some reason, talk to Dr. Asante Le Blanc herself, you can also do that. We shared the numbers before, but I know the doc will share it again. But I do want to tell you now, God willing, health and strength. Our next episode of that will speak to the breast cancer survivors, how going through radiation, the different therapies that need to be applied, how their lives have changed as a result of being diagnosed with breast cancer, because we don't want to leave you guys out who have, maybe some persons need some help going through this process. And there's some amazing ladies who are looking on right now. So Dr. Asante Le Blanc, finally, just give us the wrap up of what we need to do when it comes to coming to, and as the chairman of the Cancer Society, I know you certainly want to encourage us to come in there as well. So talk on that again, and also just give us the details about your clinic, location, and contact info.
I really would like to dedicate this show to all those that we have lost to cancer, be it breast cancer or otherwise, including my dear grandmother, Viola Burnham. It's a very important time for us as human beings, and I want you to remember that screening is important, but also cancer is a lifestyle disease, and we need to be proactive. And you hear that constantly. And now our mental health is something that's so precarious and so attacked due to COVID, because of our lack of ability to have that human contact that we knew about, just traveling, doing things that we used to do. And that reset has caused tremendous, tremendous problems on our mental health as individuals. So I urge you to please get screened. Do not delay your screening due to COVID. Get screened. The Trinidad and Tobago Cancer Society is located at 69 Dundonald Street in Port of Spain, right next to Haagen-Dazs, off the Savannah. You can call us. You can reach out to us on Facebook, Trinidad and Tobago Cancer Society, on Instagram, Trinidad and Tobago Cancer. You can contact us at 800 TTCS. You can message us. You can email us at projects@cancertt.com. Do not hesitate to get involved. We are there. We have so many services that we offer, including our palliative care service, which is the Vitas House Hospice for terminally ill patients due to cancer. So that's a different conversation as well, JD. But October is also a celebration of palliative care.
Really?
And so that is a part for us. Yes, it is.
Oh, great.
Yeah. So it's important to understand that the Trinidad and Tobago Cancer Society has been here for Trinidad and Tobago over 50 years. We will continue to be here for Trinidad and Tobago because we believe that we have to break that barrier to access to screening services for all of the population of Trinidad and Tobago. So it's to level the playing field when it comes to access to quality care at the lowest possible price. So thanks to the government of Trinidad and Tobago for our subvention as well, which allows us to do that for you. And to corporate TNT, we urge you to continue supporting us because this is your give back to your country. JD, I really would not highlight my clinic this evening, simply because I think this is important for the Trinidad and Tobago Cancer Society. I do have double functions here this evening, and it is my give back. And I truly would like to say to all our survivors, both who are members of our survivor group and those who want to join us, give us a call. Remember, we're going to have an event for the survivors later this month as well. So give us a call if you need to register for that. But we will also do an Instagram live as well during this month for survivors and next month as well. But this is our year to celebrate survivorship. And that was our plan all along, because we want people to understand that there is life after a cancer diagnosis. and that it's not only about death. And also, most importantly, the importance of screening. Get screened today. Do not delay that screening test. It's very important. And understand your body, speak to your physicians, look at your health very carefully, and don't let COVID deter you from taking care of yourself.
Yeah. One final note before we go, as you said, COVID. Anything you want to talk to about anyone dealing with breast cancer and dealing with COVID at the same time? Is the rule the same,
It's
like what we spoke about some time ago about just cancer on a whole with COVID-19?
Yes, it's the same. And so your oncologist and your team will speak to you about your treatment and determine what treatment has to continue. All of the safety protocols are in place. So do not be afraid to continue your treatment. Speak to your oncologist team, your oncology team, sorry, and your doctors will be involved, your GPs as well. And you do not be afraid to get screened, to get treated. All the safety protocols are in place right now at the public and the private sector institutions.
All right, great. So thank you so much, as always, Dr. Asante Le Blanc, for another rich conversation. Today we focused on breast cancer awareness and screening. It is Breast Cancer Awareness Month, and it's certainly just this point to encourage you to go out and get yourself screened. Do it, all right? It is important. It's your life we're talking about. So next week, I already got the promise from Dr. Asante Le Blanc. Yeah, we're going to look at the breast cancer survivors, because you just mentioned it's all about survivors, paying attention to them and recognizing the journey they have endured. So that's for next week inside another episode of the live checkup. The contact details, you would have heard it before, of the Victoria Clinic if you want to communicate with Dr. Asante Le Blanc. So Dr. Le Blanc, thank you as always, for giving us some time.
You're most welcome, JD.
Yes.
Thank you very much, and good evening to all. And please remember, don't give up hope.
No.
Support is very important to all of you who are surviving this disease. Give a call, reach out to them. They're still there, and they are so strong. And as survivors for cancer, any disease such as cancer, the strength that those women have and those survivors have is so amazing. And I really would like to say to them, I hats off. And I have a friend, JD, who's actually right now going through a very sad time in his life with laryngeal cancer, and which is voice box cancer, and he is documenting his journey all through that, and it's really tear-jerking, and it's really humanizing, and really amazing to see the power that we as human beings have. And so I do dedicate this show to them, and really and truly, we need to stop our toxic habits and really revamp.
Yeah. Well, thank you very much as always. And guys, I hope you got your questions answered. Of course, you could have put that in the chat below. Click like and subscribe, share with someone. You're not the only one who needs this, so please share. As always, I'm JD. Have yourself a beautiful evening and enjoy the rest of your week. Thank you so much.
Thank you. Bye-bye.
And that's it. Another episode of The Live Checkup with Dr. Asante Le Blanc. This is where I say to you, thank you for your time. Thank you for listening. Thank you for the questions as well. You help me do my job even easier. And of course, it's always good to have Dr. Asante inside of our world virtually discussing some of the very important topics pertaining to our health. Now, if you've got that topic for a health discussion with Dr. Asante Le Blanc, don't hesitate to connect with us. In fact, send that email to jdsocial868@mail.com. Yeah, and we'll certainly put our heads together and bring forward another one of the episodes with you in mind. So don't forget, jdsocial868@mail.com. Check out my website as well if you're looking for any voiceover talent or maybe a host for an event, whatever it may be. Check it out, www.jdmedia868.com.